Hello and welcome. My name is Nelly Gishobi. I am a psychologist and a mental health advocate. Welcome to this channel where we talk about psychological issues, mental health issues, and lifestyle issues in a way that is going to help us become the best version of ourselves and have a better human experience. Today I want to continue with the series I had started on my previous video on men's mental health. And today I want to talk about postpartum depression. And of course, this is something that has not had the attention it deserves, like postpartum depression in women. Because of course, most people don't believe that the man can also have postpartum depression. And surprisingly, 25% of men have postpartum depression, especially new fathers. 1 in 4 new fathers have postpartum depression. And it occurs 3 to 6 months after the child is born, and it may extend even up to 1 year. And of course, this is a huge transition. This is a new role that the new father has, and of course, it may take a toll on them if it's not treated and diagnosed properly. And of course, postpartum depression in men occurs. It may occur even when the woman is not having postpartum depression, and it is an episode of major depressive disorder. Some of the risk factors that are associated with postpartum depression in men are, of course, if this person may have had a history of having depression or may have had a mental illness before, or OCD, which is mostly associated with postpartum depression. There may be financial challenges that may contribute to this, because of course, if you are not financially prepared for the roles of a father, it may take a toll on you. There may also be marital problems. This is a time where there may be disagreements between the mother and the father of the newborn. Another thing, of course, is hormonal changes. Most people think that it's only women who go through hormonal changes when they get pregnant and after they get a child. But of course, even men have changes in testosterone, vasopressin, prolactin, estrogen, and all these hormones. So they may also cause postpartum depression. And of course, another thing is the man thinking that the woman is bonding with the child more than they are communicating with the man or bonding with them, and so the man may start acting out and having these depressive symptoms and start having postpartum depression. Another risk factor is comorbidity with maternal depression. If the mother has postpartum depression, some fathers are affected and they may also develop postpartum depression. So some of the symptoms you need to look out for, and especially the people that can be able to notice the changes, are the people that are close to the fathers, to the new fathers, or to the father who is experiencing postpartum depression. One of them is, of course, irritability. Men act out when they have depression. They start having arguments, constant conflicts, disagreements, and this person may not have been like that in the past. So you need to watch out for those behavioral changes, irritability and anger and all that negativity. Overworking. Some people start overworking, and they may feel, when the mother is bonding with the child, they may feel left out, and some people may start wondering what is their role in all this apart from providing. And as I always advocate for, men are providers, yes, but they are also human beings, so they need to be incorporated generally into everything. And of course, the mother may not be doing this consciously, excluding the father, but that's what the father may think, because the society views the father as a provider. That's how it has always been viewed. That is what has been the narrative all along. Another symptom is weight loss or weight gain, insomnia, being engaged in addictions, gambling, substance abuse. Sometimes you may see someone start using drugs or alcohol and that kind of a thing, and they were not doing it, and they have a newborn, and you think that they are celebrating, but some of these people are undergoing mental health challenges because of postpartum depression. And because of course they may be unable to talk about it, it goes untreated again and undiagnosed. Another thing is restlessness, fatigue, being tired, feeling tired all the time, is another symptom that may indicate that this person may be having postpartum depression. Ideations of suicide, feeling worthlessness. This person all of a sudden is not interested in life and they feel like they want an exit plan. People need to be very careful around, even if it's the workplace and you know somebody got a child, be keen to look at their behavioral tendencies and how they are processing things, how they are talking, how they are functioning, so that you can be able to help and raise an alarm if you feel that they could be going through postpartum depression. That ideation of suicide and feeling like they don't want anything to do. A new child is in their lives, but instead of celebrating, they may be feeling like it's overwhelming for them, and all these symptoms may start being seen. And of course there are so many effects that come with postpartum depression, especially in men, because now the man is the one who most probably may be providing, and now they are mentally challenged. They have a mental health challenge, so they may bond very little with the child, or they may not even bond with the child. And the child may also have emotional problems growing up because the father becomes distant. The father is dealing with his own problems, so they may not be able to be there for the child, and the child will have developmental problems. And of course there may be marital problems because maybe the woman may not understand that this man is going through postpartum depression, and because we're expecting it's the woman who's supposed to go through postpartum depression. So there may be those problems. There may be extramarital affairs, because now this person may try to find what they can use to cope with this huge change that is happening in their lives. There may be substance abuse, and of course many other negative things. So a lot needs to be done when somebody is aware. The treatment can happen. You can have psychotherapy, you can have medication, or you can have both of them according to the practitioner that is helping you deal with this situation. And of course I always say that mental health is very important, and any mental health challenge or illness is reversible. So I would advocate the gaze being shifted from the dyad to the triad. Let there be involvement of the family unit, both mother and father and child, when it comes to counseling before and after the child is born, so that people can be able to understand how to have a smooth transition into parenthood. And of course there's a lot of toxic masculinity on social media. I always advocate for someone understanding that you are an individual and you don't need to get into negative group mentalities, because you are the only one who understands what is going on in your life, what is going on with your child, with your wife, what is going on with you financially, mentally, psychologically. So you are the only one who can be able to bring a positive change. And instead of engaging in these toxic waves, you can be able to stand your ground and man up. Manning up for me means being able to sort out your issues without following the masses. I would also advocate for paternal leave, paid paternal leave, so that the father can be able to focus on helping the mother and child without having to think about financial challenges. And so at this point I would like to kindly ask you to shift your attention to the subscribe button, so that you can subscribe. If you haven't, consider sticking around and engaging me in the comment section. Share the content, turn on the notification button, comment, and all these things that will help me reach many people on this advocacy on men's mental health. So until the next video, see you.